Yes, we did a systematic review and meta-analysis of observational studies of uh, patients with pre-stroke dementia or cognitive impairment who had been treated with thrombolysis and thrombectomy. And perhaps unsurprisingly, we didn't find too many studies out there that had looked at this topic, but we did find 5 observational studies that had looked at the use of thrombolysis in patients with dementia compared to patients without dementia. And in total, there were over 1,000 patients with dementia, and there were nearly 3,000 patients without dementia in that analysis that we did of these studies pooled together. And at least in the thrombolysis population, it seems that there aren't any significant differences in the attainment of favorable outcomes, mostly thought of as a return to pre-stroke baseline. And there, interestingly, aren't any major differences in mortality or in the occurrence of intracerebral hemorrhage, and whether you're looking at any kind of bleeding or symptomatic ICH for patients undergoing thrombolysis. With respect to thrombectomy, we only found one observational study, and honestly, it was a fairly small number of patients that were treated. There were about 9,600 patients without dementia in that population, but only a few hundred with dementia. But we found that there were no significant differences in the outcomes, apart from an increased odds of ICH in that particular study for those with pre-existing dementia, although that was attenuated with adjustment. So overall, the conclusion that we reached was that there weren't major safety concerns in the use of reperfusion therapies that we could find when we looked at the balance of the evidence in patients with dementia or cognitive impairment. But the efficacy of these therapies in this demographic does remain uncertain. And so we need more rigorous studies that include also a more nuanced interpretation of outcome that takes into account the fact that, like I said, we can't get these patients better than they were when they came in with their stroke. And so we need to adjust our measurements a bit accordingly.